Hey everyone, welcome to the Canine Culture Podcast, where we talk about everything dog. Q&As with veterinarian professionals, rescue operators, everyday topics. We cover everything dog on this podcast. So make sure you subscribe to the Canine Culture Podcast on your favorite podcast platform, and make sure you're following us on social media on both Instagram and Facebook. Thanks again for listening. Now here's that next episode. Welcome everyone to the Canine Culture Podcast. This is your host, Brittany, and we have a return guest today, and her name is Sam. Today we're talking about cancer. This is an episode that I've been wanting to do really since I started the podcast, kind of one of the reasons I actually started the podcast. We found ourselves battling doggy cancer in 2016 with no resources, no help, and that's kind of led me on this journey. So welcome to the episode, Sam.
Hey, thanks for having me.
So for anyone that missed the previous episode with you, give us a little bit of an introduction of who you are.
Sure. Like you said, my name is Sam, and I'm a certified dog trainer here in Jacksonville, Florida. I'm also the owner of Mango's Dog Boarding and Wonelli Positive Canine Training. And I actually spent about the first 10 years of my working life working in veterinary clinics, all the way from a kennel assistant up to a technician. So I have quite a bit of background in veterinary medicine, which helped me and my dogs battle with cancer.
Yeah, so like Sam said, so she dealt with a similar issue, and I think a lot of people deal with this issue sometimes not even knowing that their dog might have cancer. So we're going to jump right in here. What kind of cancer did your dog have?
So Nellie is my almost 8-year-old Australian Shepherd, and she has T-cell lymphoma, which is the more aggressive type of lymphoma. There's two different types, but hers is the more aggressive, and she's gone through some things to take care of this, but it took us a while to get there.
So that's actually the exact type of lymphoma that our 11-year-old Pomeranian had when we found out in 2016. And then one of our other Poms recently had a tumor. I don't remember the name of the tumor, but it doesn't normally move around. It's kind of localized and you can remove it. So that kind of brings us to the next question of, what were the signs that made you go check it out? Or maybe, did you think it was cancer, or kind of what led you to that?
So with my dogs, because I'm a little bit of a crazy dog mom, I do basically daily pat downs of them, giving them kind of an at-home physical exam because I have two very fluffy dogs and I don't see things on them because they're full of hair. So I was just petting her one day and I noticed she had a lump on the side of her neck, kind of on her throat area. Instantly in my gut, I said, this is cancer. I got to get this figured out. Because of where it was, I thought it was probably her lymph node, but it was a bit weird that it was only on one side. But it was just a daily routine of ours that I noticed something was off, so we got her in the vet right away.
So ours was a little bit different with lymphoma. It took us a while to recognize it. So Chloe was eating less. She was getting more tired. But she was 11 years old. So we're like, oh, she's aging. Even the vets, they didn't do anything about it. They're like, yeah, she's older. She's 11. She's going to play less. She's going to eat less. And we really didn't know how less she was eating until we separated the dogs. And we realized that Titan was actually eating her food. She wasn't even eating. And then it just kept getting progressively worse to the point where she started to lose weight. And I think that was like the big red flag for us. And then for Titan with his tumor, he just had a little scab, and the scab didn't get better for a year and a half. And it changed shapes and colors and sizes, and everyone said, no, that's just a cyst that's ruptured a few times. We let it go for a year and a half. And then kind of like your gut telling you, I was like, no, this isn't normal. I don't think this is a cyst. Like, these things don't change colors and shapes.
Yeah, it's, when you notice those things and you think this is off, it's better to get it checked out because you don't know what it is. So especially things like that with the skin cyst or something that's not going away, it's better to get it looked at and be told it's nothing and find out it's nothing versus waiting and seeing, in my opinion.
Yeah. So when you guys kind of discovered that lymph node, so what was the process for getting diagnosed? And then, once you had that diagnosis, what kind of options were you given?
So it took us a few weeks to actually get a diagnosis for her lymphoma, probably because I caught it so early that it just wasn't showing up on tests like it normally would if we had seen it later. But essentially what we did is I took her into the vet and I said, hey, this is going on. She's got this lump here. And we started with what's called a fine needle aspirate. So they take a little bit of the cells, they look at it under a microscope, and it just showed some inflammation. So our vet basically told us, okay, we can kind of wait and see, try some things to see if this is maybe from a tooth root abscess or something more common, I guess. And she was like, we'll try this, we'll try some antibiotics and see if it helps get rid of that. So we tried that first, no difference. Then we kind of went to we can wait and see if anything changes, or if you want, we can do more diagnostics. Luckily for me, I have the resources and I know enough that I wanted to go do more diagnostics right away because I wasn't going to wait and see with her. So basically I had them, because I have a background in veterinary medicine, I kind of know where I wanted to go, but I had them just sedate her, take some x-rays of her mouth to see if there was an abscess, which there wasn't, do full blood panels on her to make sure there was nothing there that looked funny, take a biopsy of the lymph node, so taking more of it than just that aspirate previously. And then I also asked them to take some chest x-rays, which I think caught them a little bit off guard because most people don't ask for that. But because I had a feeling I knew it was cancer, I didn't want it to be already spread through her body and not know that right from the start. So when everything came back normal, we had to wait a few days for the biopsy, got those results back, and it did show lymphoma, but it didn't present quite normally. So our vet was kind of like, well, we can try to kind of treat things here pretty mildly, or you can take her over to the specialist. So we took her over to the specialist at Southeast Veterinary Oncology, and we did some further tests there and got her started on a chemo.
This is pretty similar to us. I mean, we kept going to the vet and they were like, well, here's prednisone and an antibiotic. And we just kept running and running and running it. And so I asked for chest x-rays and she was like, that's not necessary. It's a waste of money and time. I said, no, you're going to do the x-rays here. They did the x-rays and you could actually see the mass. It had collapsed one of her lungs, basically. That's how big it was. And we were basically told, she's so sick, don't come back, don't bother. I asked for blood work and we did end up getting a blood panel. Her CBC count was off significantly. Her liver function was impaired and high levels of inflammation. So we had a wellness insurance plan, if you will. And so they immediately disqualified us. We had to keep paying for it because it was a contract, but they said, don't come back. We will never see her again. And so I wasn't even really given the option of going to an oncologist. I just Googled it. Went to the same facility you did, SevoMed, here in Jacksonville. And we did the aspirate. And I think right away we were able to ascertain that it was lymphoma with all the other stuff that we had kind of under our belt. And we started chemo with them. And then, which sort of takes me into this next little part of the treatment. So for us, we did a couple rounds of chemo, different types of chemo. And then we did radiation. And then we went back to chemo. So what about you guys? What kind of treatments, once you figured out it was lymphoma, what did you guys do?
So your treatments were more in depth than ours, probably because yours was farther along with your dog. But basically when we went in, we started with an abdominal ultrasound to see what things were looking like internally with her, making sure the lymph nodes in her abdomen weren't enlarged or things hadn't spread there. And then we did another test to determine that it was T-cell lymphoma instead of the B-cell. Once we got that back, then we started on her chemo protocol. So basically we went in every 2 weeks over the course of 6 months. She got 2 different types of chemo plus some prednisone in the beginning, but didn't have to have anything like radiation or anything extra. It was just that round of chemo. To make her case a little bit different, she does have what's called an MDR1 recessive gene. So that means she doesn't process some of the drugs that are used in chemo or even things like ivermectin that's used in heartworm treatments, as well as other dogs. So with that, we had to lower her chemo dose, which the thought at that point is this may not work as well as we'd like it to because she's getting less right up front. But luckily, everything worked out really well with her. So we lucked out and didn't have to do the extra radiation or extra chemo at this point.
So could they have removed that lymph node, or was that never an option?
So that would have been an option if it hadn't spread to other lymph nodes. Because it was just the one that was actually swollen, we did that extra aspirate to determine if it had spread. So our oncologist took aspirates of both lymph nodes in her neck, and it did come back that it was in the other one. It just wasn't swollen yet. So if it would have just been the one, we would have just taken that out, probably done some chemo or some radiation. But because it had spread, chemo was our only option.
Okay. Yeah. With us, with the way that had impacted her lung, it was essentially just too dangerous to remove it. And then kind of back to Titan with his little teeny tiny tumor situation, they just cut that out. They expected to do like a little, oh gosh, I forget what it's called, like a pin. What do they call it? It's like a pin something, and it's a very, very small sample, and they ended up taking out a pretty large tumor. But I mean, his was easy. It literally, you took it out and he was fine. So for you guys, in addition to the chemo you were doing, and of course a little bit of the prednisone, did you guys do anything else?
So I had already kind of been making most of my dog's food. Diet, in my opinion, is one of the most important things we can have. It's either going to help you or it's going to hurt you. So I didn't really change anything there, but I do think giving them some homemade food had made a big difference. And then I also added a few different supplements for her, like an immune support supplement, just to make sure that if it was going to help, I was doing the best I could for her. If it wasn't going to make any difference, I was still giving it my all. And then the other thing I did with her is I made sure I got her out and got her physical a bit more. My dogs are not couch potatoes by any means, and they weren't terribly overweight, but with Nellie, she was carrying a few extra pounds. And with cancer, those few extra pounds can make a big difference. So we just made sure to get her moving, eating well, living her best life.
Mm-hmm. Yeah, we started meal prepping for Chloe. That was really new to me. I mean, it's pretty obvious now that food affects your dogs the same way it does people. Mm-hmm. So for us, at first we were kind of just making things. And I discovered there's a keto facility in Texas, and they do try to get dogs into ketosis to try to essentially starve the cancer cells. Mm-hmm. And it depends on the efficacy of that, like how far along you are in cancer. So we never really got her into keto, but I do think the diet made a huge change. And quite frankly, she wouldn't eat anything but what was in her diet. Like, she didn't want dog food. She didn't want any of the other stuff. So, and it was mostly like ground turkey, ground chicken, some fish, coconut oil with like some green beans or Brussels sprouts or asparagus. And then that was also when I kind of discovered CBD for both the dogs and for myself. Just reading about the efficacy of CBD. And I know there's probably not a ton of studies, mm-hmm. but I do think a lot of people are discovering it's good for anxiety, inflammation, just everything. And that inflammation, it's systemically high when you have cancer. And then I think the last thing we really did that was extra was the acupuncture. And I was working as a retail manager. I had a client come in and he was like, "Has your dog done acupuncture?" And I was like, "That's woo-woo. That's trash. I would never waste my money." And he swore up and down, and he literally said, "I will pay you back if this doesn't work. We'll cover it. We'll figure it out." And I said, "Okay, I'll try it once." And I went in. I said, "Hey, she hasn't eaten in 2 days. She hasn't slept. I don't know what they did in that hour, but she came home, she ate a full meal, and she slept 8 hours." Yeah. And I literally thought it was witchcraft.
Yeah.
It's insane how well the acupuncture worked. And kind of part of that, we did some different Chinese herbs. But again, we were so far gone that the Chinese herbs, they didn't really do much. So for us, we had probably, I think we bought ourselves 7 to 8 months, did everything we could. Spent an amount of money that no one wants to know about. We had to sell our house to pay it off. We had so many bills, and we even had friends chipping in, paying for some of our bills. Like the radiation itself was a couple $1,000s every treatment, in addition to the chemo, the acupuncture. Mm-hmm. We even got to the point where we were going to the hyperbaric oxygen chamber almost every day. And that's when we really knew, like, okay, we're kind of at the end.
Yeah.
But I know you guys were luckier. Like, you guys caught it with those pat downs. And so how long has it been since her last chemo treatment?
So since her last chemo treatment, it's been about 6 months because she just hit her year since she was diagnosed. And so far, everything has gone great. It was not cheap, like you said, but I don't think I had quite as many bills as you because I caught it so early.
Right.
And she responded so well to just the chemo, which I'm more than happy with. But she is as happy as can be. You would never know that she has lymphoma because it's still there. That's something I think people don't realize. And if I'm ever incorrect about this, somebody please correct me. But from what my oncologist had told me, she would go into a form of remission, but it would always be there. And it's a matter of when it comes back, not if it comes back.
Could you guys do regular chemo treatments to keep it at bay?
I'm not a vet, so I don't know that for sure. It probably would be more hurtful to do that than anything.
Yeah.
At this point, she just goes in every 2 months and does a physical exam to make sure nothing's changed with her lymph nodes or her attitude or anything else. So we're going to keep on that path and keep her going as long as possible.
Yeah. I didn't really know it kind of stayed in remission. You think of it as curing or healing and kind of just being done with it. But I mean, a lot of people are kind of the same thing. They go into remission and then in a few years it might come back, whether it's environmental or genetic or, largely dependent upon what kind of cancer it was as well.
Yeah, exactly.
So what advice would you have for dog owners who their dogs have cancer, no matter what the stage, no matter, where they're at? Just what advice would you give them?
So a few things. I would tell you to ask questions. If you're not sure about something, ask because you're going to get an answer. You're not going to get an answer, but you need to be asking if you're not sure. And always ask about your options too. If you're given an option that you don't think is the right choice, or you might want to see what else is available, just ask, and advocate for your dog too, because vets are out there doing the best they can. And I truly believe they're tired of hearing that people can't afford things for their pets, or they're tired of being told no, or whatever it may be. But if you have the means and you want to take care of your animal the way you think they should be taken care of, just tell your vet that. Have an open conversation with them and let them know where you kind of stand with things, and they're more than happy to work with you 9 times out of 10. So those are kind of my big things. Just ask and advocate.
Yeah, I think so many people don't want to ask because they're like, well, they're just going to run up a bill. And quite frankly, most vets, they don't want to run up a bill. They genuinely are giving their opinion of what they think your dog should do. And with their education, background, and experience, they're usually right. Or they're at least trying. It's like a human doctor. They're going to try their best. They don't know everything. They can't be perfect. They're human, but they're going to try to give you those options. But you have to ask. They're not just going to throw things at you. You really do have to, like you said, advocate for your dog.
Yeah, exactly. And, if you have the means to do that, or if you want to get stuff done with your dog, those diagnostic tests are where it's going to be. You can only see so much from a patient who can't talk to you. So it's important to have those extra diagnostics because that's where you get your answers.
And I think there are some nonprofits that try to help with different bills that you accumulate. I do think there are some different financial options. I'm not really aware of any of them. I think everything with us happens so quickly that we just credit card. And I can't say I recommend that at all. So I say, if you think you are getting to a point where your dog might have a terminal illness or just a major illness in general, maybe start exploring those different financial options.
Yeah, and coming from a vet clinic where, this is a daily occurrence for the vet staff, especially your front staff, there are a few options out there. Things like Care Credit or Scratch Pay are great options instead of putting things on a credit card and racking up interest or other debts. And depending where you live, a lot of times there are those nonprofits or rescues who have funds for people to help their dogs. So don't be afraid to ask about stuff like that either, too, because it's there and it's available.
All right, Sam, well, thank you for talking about this very tough issue that so many people probably just kind of deal with on the sidelines. They don't want to talk about it in front of other people. They don't want to bring it up, but I think it's important to talk about these everyday issues, whether it's with people or with dogs, and just get the awareness around it. So I appreciate you doing the episode.
Yeah, of course. Thank you for having me.
All right, guys, tune in next week for the next episode. And as always, if you want to be a guest or you have any recommendations, email us at canineculturepodcast@gmail.com. Thanks, everyone. Thank you for tuning in to the Canine Culture Podcast. Please make sure you subscribe to the Canine Culture Podcast on your favorite podcast platform, and make sure you're following us on social media. If you have any recommendations, any topics that you'd like to hear, if you know of any guests that would be good for the show, or if you yourself want to be a guest, please reach out to us. Send us an email at canineculturepodcast@gmail.com or send us a direct message on social media. Thank you for listening, and please share this with any of your dog-loving friends.